Welcome to The Explainer. Today we're unpacking something absolutely massive. We've got an unprecedented, highly detailed, 50-page legal outline here. This document literally lays the groundwork for a massive constitutional lawsuit aimed right at the heart of Japan's national health insurance system. We're going to look strictly at how the plaintiffs are structuring their arguments and, the evidence they're bringing to the table.
So here's our roadmap for today to see exactly how they're building this case step by step. First, Japan's NHI stealth tax. Second, a demographic metaphor they called the Village of 100. Third, the tragic human cost. Fourth, a look at this as a global anomaly. And finally, the three-pronged lawsuit itself.
Jumping right into Section 1, Japan's NHI stealth tax, the unconstitutional burden.
The plaintiffs kick things off by identifying a core systemic problem right at the legislative level. They call it a stealth tax. According to the litigation outline, the annual cap on insurance premiums hasn't just gone up, it has absolutely skyrocketed. It's jumped 2.7-fold to a staggering 1.13 million yen over the last 30 years. But here's the real constitutional sticking point for the plaintiffs. These increases were enacted quietly by cabinet order. They completely bypassed open parliamentary debate in the Diet entirely. And the plaintiffs argue that, that directly violates the democratic principle that major financial burdens on citizens absolutely must be decided by elected lawmakers. And it gets more interesting when you look at how that 1.13 million yen premium cap is actually broken down. It's not just paying for your personal medical care anymore. A big chunk of that premium is now funding broader social policies like the child and child-rearing support portion. The plaintiffs argue this decisively breaks the whole constitutional premise of mutual medical aid. Their point is when you charge people an insurance premium to fund general child allowances that are completely unrelated to their own medical risk, actually, scratch that. It stops being insurance altogether and just becomes a general tax in disguise.
Moving right along to Section 2, the Village of 100, a demographic shift.
To really grasp the demographic collapse happening here, the legal brief uses a fantastic thought experiment. They ask us to imagine the national health insurance system as just a tiny village of 100 people. Back in 1965, you had 6 working-age supporters for every 1 elderly person. Because that burden was spread out nicely, true mutual aid was completely viable. But jump forward to 2023, and it's 1.07 working-age supporters for every 1 elderly person. The plaintiffs argue that true mutual aid is literally physically impossible when the burden has shifted to a nearly 1-to-1 ratio like that. It goes from being shared support to, in their words, one-way exploitation. And that brings us to a crucial point about the generational reversal of the burden. Working-age cohorts, so folks from 20 to 59, are actually paying significantly more in premiums than they ever consume in medical costs. Take people in their early 30s or early 50s, for example. They're paying premiums that are essentially double their actual medical expenses. Meanwhile, for those 70 and over, the costs they generate are way higher than the premiums they pay. The plaintiffs use this data to show that the system's foundational promise, enjoying medical care at a low cost, has completely flipped upside down for the working generation. Let's look at Section 3, the tragic human cost, when the safety net fails. Because, this systemic burden isn't just numbers on a spreadsheet. For the plaintiffs, it is devastating, literal life-or-death stakes in the real world. The lawsuit emphasizes that over 1.83 million households are currently delinquent on their premiums. To put that into perspective, that is roughly 1 in 9 households in the entire system. The plaintiffs describe this not as individual financial negligence, but as a structural infringement on the right to life. It's driven by premiums that are mathematically impossible for many people to ever afford.
Furthermore, they really highlight the aggressive collection tactics used by municipalities. In a single year, local governments executed over 327,000 asset seizures against these delinquent households. And we're not talking about slow, drawn-out legal processes here. These often involve instantly freezing bank accounts without a court warrant, basically stripping citizens of their bare minimum living funds overnight.
To humanize all this data, the brief cites some truly tragic, documented cases. They mention a non-regular nurse in her 50s who developed symptoms of a severe illness. When she was ordered to be hospitalized immediately for suspected cancer, she delayed it, saying, "I'm worried whether I can pay, so I can't be admitted." She basically fell through the institutional relief cracks because her meager income was just slightly above the public assistance threshold. By the time she was finally persuaded to enter the hospital, it was too late. She passed away 10 days later. Or consider the case of a carpenter earning a really modest 150,000 yen a month. The brief details how, without any warning whatsoever, his local municipality seized 70,000 yen directly from his salary account the exact moment it was deposited. This immediate seizure threatened his very survival. He was left unable to afford food, let alone come up with the medical costs for a chronic illness he had. The plaintiffs argued that targeting a bank account the exact second a paycheck clears is an unlawful circumvention of the very laws meant to protect a person's minimum living standards.
Which brings us to Section 4, a global anomaly, Japan's unique system.
So how does all this compare internationally? Well, the plaintiffs assert that Japan's system is uniquely flawed on a global scale. They argue Japan operates a high-burden, low-benefit system. Unlike countries like Germany, the UK, Canada, or Australia, where outpatient and inpatient care are largely free at the point of service, Japan imposes a 30% window copayment right on top of its world highest-level premiums. Plus, there is absolutely no mandatory income security, like an injury and illness allowance if you happen to get sick and can't work.
The core mechanical flaw they identify is in how these premiums are adjusted. The brief surveys 12 different countries, and out of all of them, Japan is the only one lacking a statutory adjustment valve. Think about it like this. In places like South Korea, Germany, or France, if you lose your job or your business closes this year, you can immediately apply to have your premiums recalculated based on your current inability to pay. But in Japan, you're stuck paying a massive premium based on last year's high income, even if you currently have $0 coming in. It's completely rigid.
Okay, finally, Section 5, the three-pronged lawsuit seeking legal relief.
With all those systemic problems and human stakes clearly laid out, let's break down the actual legal solution the plaintiffs are pursuing. The litigation outline proposes a simultaneous, nationwide joint action with three distinct, strategically layered legal claims. We're looking at a declaratory action, a state compensation claim, and a claim for restitution of unjust enrichment. Let's see what each one of these aims to achieve.
The first step is the declaratory action, and this is aimed directly at the municipalities. The goal here is a forward-looking confirmation that citizens are simply no longer obligated to pay the arbitrarily added premiums dictated by the cabinet order. If they win this, it creates a preventative resolution. It stops the unconstitutional billing right as its source for any future payments.
The second angle escalates the fight entirely. This is a state compensation claim directed right at the state itself. Here, the plaintiffs are demanding compensation for the sheer damage of being forced to bear an unconstitutional burden. This serves as the bold, public message of the lawsuit, basically aiming to hold the central government fully accountable for creating and then totally neglecting a system that is crushing its citizens.
Finally, we have the restitution of unjust enrichment claim, which again targets the local municipalities. The goal here is to force a refund of collected money, and this is vital. Legally speaking, this is the only avenue available for citizens to actually recover the funds they lost to those sudden, devastating bank account seizures we talked about earlier.
Ultimately, walking through the plaintiff's 50-page litigation outline leaves us pondering a really fundamental question about the entire future of healthcare. The plaintiffs have laid out this meticulously structured argument claiming that a system originally designed to protect life is now actively threatening it. And, whether you agree with their legal theories or not, the data they've compiled asks us all a serious question. When a safety net becomes a financial trap, how does a society redefine mutual aid? Thank you so much for joining us for this explainer, and keep asking the big questions.